Welcome to page 96 of Anatomy Coloring Book, the Visual System, Part 3. There are muscles surrounding the eyeball that make the eye move. The extraocular muscles and the intrinsic muscles. The extraocular muscles consist of the superior rectus muscle. Rectus means straight, so an oblique means not straight, or at an angle. And the superior rectus muscle, it has a job. Its job is to elevate or pull the eyeball in the upward direction here. This is an upward rotation, and that's the job of the superior rectus muscle of the eyeball. On the bottom, we have the inferior rectus muscle. Again, rectus means straight, so it's going to pull the eyeball straight down. That's the inferior rectus muscle. And here's the downward movement of the inferior rectus muscle. Another word for that is depressing or bringing down, the depressor muscle. The lateral rectus is, and this is the left eye here. So the lateral rectus muscle is here on the lateral side of the left eye. Its job is to abduct the eyeball, in other words, bring it outward. Keeping in mind this is the left eye, so there's another eye over here. And so this is outward. So it's an outward rotation, an abduction of the eye. The medial rectus is this muscle here on the medial side of the eye. And of course, what it does is medially rotate the eye or bring the eye inward toward the nose in adduction. The lateral rectus performs abduction. The medial rectus performs adduction. The superior oblique muscle originates posteriorly and then curves around through this little sling here called the trochlea and inserts on the superior lateral portion of the eye. And its job is to, and you can see by the way it's pulling, to rotate the eye sort of in a counterclockwise direction, or rotate the eyeball in this way. The inferior oblique muscle has the opposite effect. It originates on the maxillary bone and in the interior portion of the eye socket, and it inserts here on the medial part of the eyeball, and its job, as you can see, is to rotate in the opposite direction, sort of in a clockwise direction. And that's the inferior oblique muscle. All of the muscles except the inferior oblique, they originate right at this circular tendon called an annular tendon, and this tendon is anchored to the back of the eye socket. And as I said, you can see how all the tendons originate right out of this this sort of common tendon right here. And of course, this is the optic nerve heading back through the same sort of hole in the back of the eye socket and the skull where this tendon attaches. There are also muscles inside the eyeball, tiny, tiny little muscles. There is the ciliary muscle right here. And it, you can see it attaching to what's called the choroid here. And when it's kind of a counterintuitive effect. When the muscle is at rest, this ligament is nice and tight. The suspensory ligament of the lens is nice and tight. But when you see this muscle contract, it pulls the choroid inward here. And see, the origin is here. The insertion is here on the choroid. And that muscle contracts in this direction. And when it does so, it relaxes the suspensory ligament and it allows the lens to sort of relax and become more convex and more circular shaped back here. But when the muscle is contracted or is relaxed, the suspensory ligament stays in with tension, and the eye is more narrow and less convex. So it's kind of a counterintuitive effect. There are also muscles and that's the ciliary muscle. Ciliary muscles of the eyeball. Inside the iris, there is a little muscle called the Sphincter Pupillae. Inside the iris, remember this is the iris here. And it is the part of the eye that is responsible for color. Inside the iris here. And over here you can see the sphincter muscle. The job is to close off the eye. It's this muscle right here. Oops. It's this muscle in the middle surrounding the pupil with a dark spot. And when it contracts, it takes the eye and makes the pupil smaller. And it's the job of the parasympathetic nervous system to cause that to happen, to contract the sphincter muscle of the eye and bring the iris inward and close off the pupil. On the other hand, there's another muscle called the dilator pupillae, which dilates and opens up the eye. In response to sympathetic nervous system fight or flight action, it's going to open up the eye. When you're in fight or flight mode and the sympathetic system is activated and you're in danger, you need to run or fight, the pupil will open wide and the iris will open so that more light can come into the eye and you're prepared for action. How is light received and where does it go once it enters the lens, the cornea and then the lens? Well, here is a diagram here showing exactly what happens. Your light is received from visual path, from your visual field, and it travels through certain pathways to get to your brain for perception. First, the left side of your visual field, light rays are coming from the left side of your visual field. Some of them will inevitably reach the inside of the medial side or the nasal half of your retina. and it will stimulate the rods and the cones here. And then we'll travel down through from the retina and into the optic nerve, cross the optic chiasm, and into the thalamus in what is called the lateral geniculate body. Here. The lateral geniculate body of the thalamus, where it's relayed on to memory centers. And then it continues, or that same stimulus, and it can head to this little area right here called the superior colliculus. And here, if it stimulus is a violent or dangerous signal, it can cause reflex action so you can get out of the way or move your head left or right. But after the thalamus, the signal will travel to the occipital lobe, to the visual cortex of the occipital lobe. Here. The outer part of the occiput, the outer layer, the visual cortex. Light from the left side, again, not only travels to the nasal side of the left eyeball, but it travels to the temporal side of the right eyeball. And actually is going to wind up in the same place, even though it took a different route. So the initial signal went from the left eye and wound up in the right half of the brain. This signal starts from the left eye, or excuse me, from the left visual field and winds up in the right eye, right lateral eye, and winds up in the same part of the brain, the occipital lobe, the visual cortex of the occipital lobe. So all information, visual information from the left side, winds up in the right occipital lobe. Even though some of that information came in through the left eye, and some of the information came in through the right eye. And obviously, it's going to work the same way from the other side. Visual information from the right part of your visual field. First, well, you rays, light travels in rays, like so. Scattered about. And so your eyes are taking in all of this information. From here, it's coming from all directions of your visual field. Here it comes in from the right side of the visual field into the lateral or temporal side or half of the retina. Traveling down through the optic nerve. Does not pass through the optic chiasm. That's this spot in the middle. The optic chiasm here. The place of crossing over. But it does not cross over. Information from the, even though it crosses over from one eye to the next, it does not cross in the optic chiasm. Some information in case of emergency. You need to get out of the way. The superior colliculus. And that will cause a reflex action if it's a fast-moving object, let's say, that's coming at your head. And will also travel into the thalamus the lateral geniculate body of the thalamus for memory processing, and relaying over to the visual cortex of the occipital lobe at the back of the brain for interpretation and stimulation. Now, from the right visual field, that was from the right visual field into the left eye. Now we're talking about the rays of light that happen to travel from the right visual field to the right eye. They're going to hit off the nasal half of the retina, the medial side of the retina, and stimulation will come down through the optic nerve, through the optic chiasm, crossing over. And if it's a sharp stimulus, fast moving, the superior colliculus will be stimulated, and it will respond by moving your head out of the way. And that information will also travel to the thalamus for relaying, to be relayed to other areas of the brain, including memory. And then will wind up giving a stimulus to the visual cortex of the occipital lobe on the left. So information from the left visual field will wind up being interpreted in the left side of the brain. Visual information from the right side of the field will wind up being interpreted on the right side of the brain. But the path they take is different because light from the right visual field will enter into the right eye and will also enter into the left eye. But the paths they take are different. So if I'm looking at my drawings here, and if I mess that up, so you see the right crossing over either here or here in the chiasm for interpretation on the left side of the occipital lobe, the left visual cortex. Information from the left ultimately winds up on the right-hand side. Some of the crossing over occurs right here in the visual field from left to right eye, and the remaining stimulus crosses over right here at the optic chiasm. But ultimately, all visual information switches sides. So the optic chiasm is, to be sure, is this spot, this crossing over area right there in the middle. Of course, the optic nerve coming off the retina. Of course, the retina is the back, the rods and cone cells on the back of the eyeball. Of course, these were the light waves traveling from the visual field. And this has been page 96 of Anatomy Coloring Book. This is Dr. Stephen Harkins.